This session is sponsored and programmed by Ontrak.
Hi, I'm Caroline Woods, and today I'm joined by Jonathan Mayhew, the CEO of Ontrak. We're going to talk about the future of virtual healthcare and more specifically, how it relates to behavioral health. Jonathan, it's so good to have you here with us, and we're going to get right into it. We, of course, saw this increased need for virtual healthcare over the past year because of the pandemic. Can you describe just how much demand COVID-19 put on telehealth and virtual care?
Good morning. All types of virtual care, we have seen skyrocket through the pandemic with COVID. And, broadly, I would try to describe that, maybe for two reasons. One is COVID itself. You had many provider offices closed or with very limited access. There were a number of regulatory reforms that made it easier for individuals and providers to receive and treat virtually. You had providers and payers change their reimbursement strategies to make it easier for individuals to be reimbursed for their treatment. And overall, you really saw a surge in provider adoption of virtual care. Before COVID, you were probably either a virtual care provider or you practice in a traditional setting. And those two things were generally very distinct. And so in COVID, we saw a real convergence of how providers were willing to adopt virtual treatment. The second thing that I would say broadly is that there's been an evolution of the consumer in healthcare. And like with other industries, whether it's maybe examples like finance and travel, the consumer has really shaped how people want to access services in those industries. And we're undergoing that kind of a revolution in healthcare today. So convenience, access, privacy, particularly when you think about receiving virtual behavioral healthcare, being able to do that in the privacy of your own home is a great convenience. And so we've seen that proliferation of the consumer's demand to access services that way.
Well, Jonathan, I think the big question now is it here to stay? Where do you see virtual care, specifically as it relates to behavioral care, going post-pandemic and beyond?
We think that it's poised to continue to grow dramatically. Before we came into COVID, the behavioral health virtual modality or industry was experiencing something like 50% annual growth. And as we look at behavioral health care, virtual behavioral health care compared to other kinds of clinical care, we're still seeing, in some instances, over 60% of all of the behavioral health clinical care being delivered virtually. And that compares, right now to, some of the industry estimates that traditional care settings are receiving about 40% of all of the care. So I think it's poised to continue to grow. I'd sort of point back to the role of the consumer. There's a lot of convenience, ease of access, affordability. When we look at some of the consumer satisfaction surveys that have been conducted, people are really, really pleased with their ability to receive behavioral health virtually. When you look at some of the provider satisfaction surveys, the flexibility for providers to administer care in a virtual setting. And I think what we'll continue to see is the development of efficacy studies around the quality of outcomes and the differences in real treatment modality that's occurring when people are receiving their behavioral health care, both virtually, digitally, as well as in traditional face-to-face settings.
Well, let's build on that a little bit more. If it's poised to grow, if it's here to stay, let's talk about how it can be improved upon. Are needs being properly met with virtual care now, and which approaches work and which don't, and how do they need to change?
Great question. I would say, virtual care has definitely helped bridge the gap. I don't know that it's fully closed the gap for all of the needs that have emerged, right? What we've learned through COVID is there's been a proliferation of a lot of need, right? Whether it's anxiety, depression, substance use. We've all read about, some of the surge in the epidemic around behavioral health. So, the demand is great. The proliferation of digital capabilities, self-help and wellness tools, as well as telephonic and virtual care being more available on more platforms, are all things that are certainly helping the consumer and provider be able to bridge some of that gap. But the treatment modalities for individuals, what we're learning is face-to-face care, making sure that there's real access to therapists, whether people are engaging in a face-to-face or a virtual manner, is sort of critical to making sure that the human touch and the whole person persona is well supported through various kinds of treatment.
Well, speaking of bridging gaps, the pandemic further exposed gaps in access to healthcare for certain underserved communities. How do you think virtual behavioral care will affect access and health equity?
Access has improved, right? I think across the spectrum of socioeconomic need. So I think that there has been a lot of documentation about the improvement that has occurred across the various socioeconomic and health equity disparity categories. One of the things I think we're beginning to understand about virtual care is its ability to link individuals with ethnic, cultural, and language matching. So the ability to do that, really helps take down some of the disparities. There's unquestionably a digital divide. So, whether it's urban or rural, low income and impoverished areas, if people don't have access to smartphones and broadband and the internet, or they're not comfortable using the internet, then all of those things, coming together will help make sure that there is even access, irrespective of somebody's geography or economic setting. So, we've made progress. There's work to do, and I think closing some of that digital divide will only further the access to underserved communities.
Jonathan, what's the role of AI and machine learning in the future of care? And what does this mean for how different patient populations are identified and engaged in care?
Yeah. I would say first and foremost, it ought to help with diagnoses. I think that there are a number of things that are going on today with advanced machine learning and AI that help claims analysis occur, so that people that may currently be undiagnosed or may not be receiving behavioral health treatment can be identified. The next sort of use of advanced analytics can really be around how outreach and access can be provided. I also think some of the more interesting areas that are currently developing in the industry are around what can occur between patients and providers. Sort of a common practice for cognitive behavioral health therapy is journaling, and a lot of that journaling has gone online. So the idea of doing digital journaling where people can reflect, develop self-awareness through how they journal. If those journals are captured digitally, then those responses can be compiled through advanced learning. Those patterns can be identified. Those patterns can be shared back with the treating physicians. And what we're learning is those things can be used for advanced outreach. People can be communicated with by their treating physician before they're maybe likely to enter into a crisis situation. And I don't think any of those things really can occur without the level of sophistication of AI and advanced machine learning. So interesting and exciting opportunities, I think, to help make sure people are connected with their providers for the right kind of matching of treatment.
For sure. And just quickly, Jonathan, finally, we saw a huge influx of healthcare apps this past year. How do people sort through them to determine which are effective and right for them?
There's a lot of information available to people to sort through all of those digital tools. The digital tools, I think increasingly are understanding that it's really the complete person and the ability to make sure that a human sits behind a lot of the digital interface that's occurring. So, one of the things that, we at Ontrak have really tried to make sure that we do is as we target individuals who may be inclined to not seek care or not be familiar with some of those digital tools, it's really, really important that when we make contact with them, sometimes through traditional communication means, that we link them with the digital capabilities so that we can stay in contact and make sure that whether it's telephonic, face-to-face, or a digital interface occurs, that the modality and the means of communicating is most comfortable for the treating patient.
Such an important topic, so we really appreciate your insights. Thanks so much to Jonathan Mayhew, Ontrak CEO.